We have been watching COVID-19 cases go up in Colorado, but the number of people hospitalized with COVID-19 has been dropping over the last week. So let's talk about why the numbers are moving in that manner with 9 Health expert Dr. Pyle Coley. So with cases rising, Dr. Coley, we would expect to see hospitalizations going up as well. Why is it that we're seeing just the opposite happen?
So Tom, this is a bit of a false narrative, and I'm really glad we're having this discussion because it leads to the misconception that we're doing well and that people aren't getting into the hospital. But the key is really to think about the concept that the hospitalizations fall behind the cases by about 2 to 3 weeks. So if you look at the graphs of the hospitalizations on the right-hand side and the graphs of the cases on the left-hand side, you can see that they're sort of mirror images of each other, except they're time lagged by about 2 to 3 weeks. So right before Thanksgiving, which was on November 26th, you see that dip down in the cases because we had all been working on mitigation measures before we all decided to get together for Thanksgiving. And that's why the hospitalizations today are going down, really reflecting what was going on in that week before Thanksgiving. Now you can see that the graphs are not perfectly superimposed because the peak back in April of hospitalizations was a lot higher because there were older people getting sick, whereas now the hospitalizations and cases are, the peak of the hospitalizations is not as high as the cases. But essentially it's the time lag that explains this. The other explanation for this, Tom, is that hospitalizations tend to occur in batches. So if you think about our behavior, we have some sort of an event like Thanksgiving, for example, and then 2 weeks later people get test positive, and then right after that they all get into the hospital together. Similarly, they all get discharged together. So when we have a lot of discharges in a row, that's because of that batch behavior.
Well, these are numbers, and we talk about numbers all the time. The numbers are important, but for individuals, when it happens in your family, it's a big deal. And for Governor Polis, it was a big weekend. The first gentleman, Marlon Reese, discharged now after just 2 days in the hospital, going in on the weekend. 2 days. Is that time frame typical? What are we seeing as far as length of hospitalization, those trends here in Colorado?
Highly atypical, Tom. I was actually very surprised to hear this myself, but what we're seeing here in Colorado is that the average duration of hospitalizations about 7 days, so about a week. Now we know that remdesivir shortens the duration of hospitalization. In the clinical trials, it shortened it by about 4 days. We're seeing about 2 days or so in the real world, but really people are still spending quite a bit of time in the hospital and doing poorly. If you look at these numbers, 27% of them, get into the ICU once they're in the hospital. 15% of them need ventilators, and you're seeing still a rate of people dying above 21% if they get into the hospital. So of course, very good news for the first gentleman, but overall I think we've made marginal progress in getting people out of the hospital and in helping them to do better despite all these months of time.
Yeah, you mentioned remdesivir as far as the first gentleman, and let's talk about what he was treated with and what we have learned over these last 9 months, how we've progressed in treatment of COVID-19 patients.
Well, as a field, Tom, we've progressed tremendously. We've made a lot of progress in knowing, when to treat people, how to treat them, with what medications. We have remdesivir and dexamethasone for hospitalized patients. We have the antibody cocktail for mild to moderate disease. But I have to say that the first gentleman's treatment, again, raises a lot of confusing questions about why that was. So remdesivir, which is an intravenous drug, is normally given for a 5-day course. He apparently only got it for those 2 days, and as far as I know, is not going home with a way to get an intravenous medication. A little unusual. The dexamethasone is really only reserved for patients that are needing oxygen or ventilatory support. In fact, there was a signal for harm in those patients that didn't need oxygen that got steroids to shut off their immune system. So again, a bit unusual. Usually a 10-day course, and the first gentleman's only getting a 2-day course at home of the dexamethasone. But again, scientifically, we've made a lot of progress in understanding the pathophysiology of the disease and designing the treatments accordingly.
Yeah, sadly, 2020 will be the year we all learned how to say remdesivir and dexamethasone and all these other things. But Dr. Coley, thanks as always for enlightening us as far as what is happening as far as COVID-19 today.